Welcome to e-learning for clinical audit. I'm going to tell you briefly what clinical audit is, why we do it, how this will help you do it, and who it's for. So clinical audit's about setting a standard, measuring our patients against that standard, and if we're not doing well enough, making some change to improve things. And why do we do it? Well, to improve the quality of care for our patients. So for example, you might decide if you look after children with diabetes, you want their blood sugar control to be below a certain level. In an audit, you would measure that. And if it wasn't good enough, you'd make some change and then crucially go back and re-audit to see that the quality of care for those children had improved. How's this going to help you? Well, in the past, to learn about audit, you'd had to read a book or go on a course. I've been doing e-learning for advanced pediatric life support, and I think it's just such a fascinating and more interesting media than reading a book. You can do it in your own time. And finally, who's it for? Well, it's not just for pediatricians. It's for all healthcare professionals. Pharmacists, physios, dietitians, nurses, doctors, of course, and especially junior doctors. They're the people at the front line who often recognize where there may be problems and often have bright ideas of how to improve things. So good luck with your clinical audits, and thank you for listening to me.